Take a look at the first case. A 57-year-old patient was admitted to the intensive care unit after cardiac arrest. Lines and leads attached to the patient include ECG leads, a pulse oximeter, a peripheral IV, Foley catheter, an arterial line, and a central venous catheter. And the patient's goal for today is to be able to get out of bed and walk to the bathroom. So, what clinical considerations do we need to factor? We need to bring the hemodynamic monitor to monitor heart rate, blood oxygen saturation, and blood pressure throughout. The IV pump can be unplugged because it runs on batteries, so you can check the battery life of the pump. The Foley catheter, remember, should be maintained below the level of the bladder. You want to ensure the central venous catheter is secure and that there is slack so it's not pulling on the patient. You may need to re-secure it prior to mobility. If central venous pressure is being monitored, there will be a pressure bag and a transducer to bring along. The arterial line will also have a pressure bag and transducer. During mobility, typically only the blood pressure will be monitored. You want to make sure the transducer is at the level of the right atrium for an accurate reading. I lots of times like to attach my transducer either to the patient's gown and the upper arm so it's at the level of the heart, or some facilities have arm cuffs that nicely fit the transducers. If during mobility you get an unstable reading in the arterial line, your first course of action would be to check the transducer placement. Sometimes it does fall and needs to be resecured. Next, if it's a radial line, you may extend the wrist to see if you can get a better reading. Patient mobility and lines and leads management in this case could likely be performed by one person unless the patient requires significant physical assistance. Let's take a look at another case. A 42-year-old patient, status post-coronary artery bypass graft surgery, or CABG, is on the step-down unit. Lines and leads attached to the patient include ECG leads, a pulse oximeter, a peripheral IV, a Foley catheter, and a chest tube. The surgical team wants the patient to walk around the unit today. So, what do we need to consider? We need to bring our monitor to monitor our vitals throughout the session. Again, the IV pump can be unplugged. Again, the Foley catheter should remain below the level of the bladder. For the chest tube, check if it's connected to suction. If it's on suction, is there an order for the patient to mobilize or travel on water sill? Can you disconnect the suction? If so, disconnect it and the patient's ready to go. If not, you would need to bring a portable suction unit with you. In this case, patient mobility and lines and leads management could also be performed by one person unless significant physical assistance is required. Let's take a look at one last case. A 60-year-old patient with advanced heart failure in the intensive care unit awaiting a new heart. Lines and leads include ECG leads, a pulse oximeter, peripheral IV, Foley catheter, arterial line, central venous catheter, an IABP with an axillary insertion, and a pulmonary artery catheter. The goal is for the patient to walk 150 feet today. What are some things we need to consider with this patient? Due to the IABP and the PA catheter, additional trained personnel will be needed during mobility to manage the lines and leads and for monitoring purposes. Most of the times, this would be a registered nurse. A physician order may be required depending on your facility to mobilize patients with a PA catheter or an IABP. With the IABP, you should have a trained personnel available for monitoring the settings throughout as well as the hemodynamic status because it needs to be someone who's trained in managing that device. With the PA catheter, it's really important to check that it's secure and locked in place prior to mobility. Typically, measurement before and after mobility is important to ensure the catheter hasn't migrated. And the waveform should be constantly monitored by trained personnel throughout the session to ensure the catheter has not moved from the pulmonary artery into the ventricular space. In summary, patients in the hospital will have various lines, leads, tubes, and drains that will also need to be managed during mobility sessions. A systematic approach can help ensure a safe and successful mobility session. Communicate any questions or concerns with the registered nurse and/or the medical team. And patients really benefit when we advocate for a culture of mobility despite perceived barriers. However, it does sometimes take a team. Thank you so much for watching this course.